Good morning, everyone. Did you know there are some countries where cannabis is legal for recreational use? And there are other countries where cannabis can be bought from medical stores if it is authorized by a physician. Substances have been used for recreational purposes or pain management since time immemorial. However, there is a very thin line between using it for recreation purpose and using it to escape one's current unpleasant situations. An excessive dependency on these substances can actually result into serious consequences. Welcome to the latest episode of Wake Up to Health Talks. Today we have with us Dr. Nirav Mehta, a renowned psychiatrist from Surat, who have been working in the field of substance abuse for the past 17 years. And he will talk to us about the harmful effects of substance abuse and how can one overcome that. Thank you for joining us today, Dr. Mehta.
Thank you. Thank you for welcoming me and inviting me.
So, sir, before we go any further, actually, when I was researching about substance abuse and drug addiction, I came across multiple terms related to this, such as drug abuse, substance abuse, addiction, drug dependency. So, before we go any further, I actually wanted to understand what is the difference between all of them.
See, rather than talking about the difference, what I wish to tell you to the people that whenever the question is, you have to remember that whenever something is harassing you and you are not able to leave that thing, that is a dependence. Moreover, there is a thing that is known as a cage criteria. They cut down, annoyance, guilt, and eye opener. CAGE. So suppose the patient is having a feeling, trying to cut down the use of substance, and he is annoyed while the relatives tell that you leave the substance. Suppose the patient is having a guilt that suppose if I will drink alcohol, I am doing bad to my family, and if it acts as an eye opener. So interchangeably, these terms are used for various purposes. But what needs to be done is that single alcohol or any kind of substance use stimulates the brain circuitry. That is known as the dopamine brain circuitry, and that dopamine reward circuitry is is responsible for this kind of dependence.
So, sir, you mentioned very interesting thing about CAGE, cage. So, how does it relate to substance abuse? What exactly is substance abuse?
See, substance abuse, when we use something, we are using something. But if we are abusing something, that is, we are not able to cut down. I wish to cut down the substance use, but I am not able to do that thing. I feel I am not worthy of I am not able to cut down. So I will feel somewhat it will be difficult for me to cut down the substance. Second thing, annoyance. So जो criteria है, the book criteria is very different. कि भाई book criteria तो अलग है, लेकिन अगर हम patient को और common man के लिए देखें, तो cage criteria है, you are in the cage of the substance. So अगर if you are not able to cut down the substance, if you are annoyed when you are taking the substance, if you are feeling guilty while taking the substance, and if the substance is acting as an eye opener, you should feel that the substance you are having is having a severe dependence.
That's actually very interesting to मतलब ये चार terms हमारे हाथ में ही हैं to understand कि CAGE, if we experience these.
We are in the cage of experience.
We are in
the cage of addiction. Yes.
Exactly. So this is actually a very important and a very great tip for everyone involved.
Sure.
So sir, while I was researching and as I said before, there are some countries जहाँ पे ये substances legal भी हैं and मतलब prescription drugs के form में भी available होते हैं. So I wanted to understand कि is there any way where we can get addicted to prescription drugs?
See, prescription drugs, what is a substance, I tell you, that any mind altering think, what alters our mind is a substance. Suppose if you drink tea and if you become alert, that is also an alerting substance. So your brain gets altered, and that is an alerting substance. So I will like to tell you that prescription medications, see, prescription medications are misused by the people, and they are medical store people. They give medications as such also without prescriptions. So the question is why and when to take medications. See, we need to know that if we are depressed, if we are sad, then we need to know that we need to clear the sadness, not the sleep disturbances. We have sleep disturbances secondary to sadness. We have sleep disturbances secondary to schizophrenia. We have sleep disturbances secondary to bipolar things. So bipolar mood disorder है. अगर कोई भी stress related issue है और मुझे नींद नहीं आ रही है, तो if I am taking sleep medications or prescription drugs for sleeping only, then I am मैं अपने पैर पे कुआड़ी मार रहा हूँ. जो basically I need to take care of my illness, that is the depression, schizophrenia, or any kind of psychiatric issue or any kind of physical issue even I tell. Suppose आपका fracture हो जाए, आपका पैर fracture हो जाए, तो you will not be able to sleep because of the pain. So that is the reason. तो वो pain, तो orthopedic surgeons also give pain medications and sleep medications. So but our psychiatric problem में क्या होता है कि the benzodiazepines, what are the prescription drugs? These benzodiazepines they create a sense of euphoria in the mind by stimulating the dopamine circuit. तो जो dopamine circuit stimulate होती है, तो उसके साथ साथ you feel high, and that's why people are addicted to these things.
That's very interesting. So I think what I understand from this is कि even if you're on prescription drugs, it's very important to listen to your doctor. And मतलब self medication तो always it's harmful. तो बिल्कुल ऐसा नहीं समझना चाहिए कि हाँ ये दवाई फायदा कर रही है, तो even if my doctor has not prescribed it, I should continue taking that.
Yes.
Listening to doctor, I think, is very important in such cases.
Yes.
And sir, thank you for shedding some light on drug abuse. I wanted to understand that if I see a friend suffering from it, or if I am suffering from it, what are the factors that one should look for, which will help me identify that this person is actually a drug addict or a substance addict, and what can I actually do to help them overcome it?
Okay. So what are the changes? See, you will see typical changes in the pattern, behavior pattern of the or friend. वो time consuming, he will not reach to the spot. If your friend who is not reaching on the spot, समझो कि 7 बजे आपने मुझे बोला है, तो 7 बजे मैं नहीं पहुंचूंगा, मैं 7:15 को पहुंचूंगा, तो मैं सब्सटेंस लेते गैदर करके आऊंगा. Then change in the personality, irritability बढ़ती है. Then excess spending of money. पहले 500 रुपये रोज का इस्तेमाल करता था, अभी मेरे पैसे नहीं बच रहे हैं. Then remaining withdrawn, कि पेशेंट withdrawn रहेगा, कि बोलेगा नहीं, आपको वो महसूस करेगा कि नहीं मैं गलत कर रहा हूँ, तो इसीलिए पेशेंट बोलेगा, आपका जो फ्रेंड होगा ना वो बोलेगा कि नहीं I am doing something bad, so he will feel something odd and he will try to not associate with you. So association with the person or relation with the person gets introverted. Moreover, the chirpiness, जो हमारे relations में chirpiness आती है, pinky chirpiness आती है, that goes away. And that if the relationships are suffering because of one more thing, the patient tries to avoid you. कि अगर आप जानते हो कि भाई आप कोई नशा कर रहे हो तो मैं पकड़ा जाऊंगा, तो I will not be in front of you, or the patient will not be coming in front of you, and he will try to avoid you. So avoidance behavior comes, and loss of money, loss of credentials, loss of integrity. Then another thing, one more thing, कि physical trauma. अगर पेशेंट को, अगर आपका कोई फ्रेंड है, अगर कोई नशा कर रहा है, तो अचानक ही उसको कोई कुछ चीजें लगने लगेगी, कि समझो कि आज वो पहले कभी लगता नहीं था, तो अभी उसके थोड़ी लगने लगा है. यानी उसको कहीं हाथ में लग रहा है, तो एक्सीडेंटल फॉल्स होते हैं, तो आपको समझ जाना चाहिए कि ही इज इन समथिंग प्रॉब्लम.
दैट्स वेरी इंटरेस्टिंग. मतलब ये ऐसे छोटी छोटी चीजें हैं जो कि हम शायद मिस आउट कर दें, जो हमें एक्चुअल में नहीं पता होगा, बट दीज माइट एक्चुअली लीड टू अ बिगर प्रॉब्लम. So, sir, this actually brings me to the last segment of this, session, where I would want to understand ki how can we help, our friends and family to get over it.
See, first and foremost thing is insight. We have to create an insight. See, only medicines are not going to work in this kind of treatment. First and foremost thing is there are many psychotherapies we use: insight oriented psychotherapy, then supportive psychotherapy, family psychotherapy, and group therapies. So suppose if I am an alcoholic, and if I am getting a treatment of alcohol de-addiction, तो मैं दवाइयां भी लूंगा, साथ में मैं मेरा डॉक्टर जो होगा वो मुझे फैमिली थेरेपी भी कराएगा. तो सी व्हाट हैपेंस कि इफ आई एम टेकिंग अल्कोहल, तो मेरा फैमिली मेरे बारे में बहुत बुरा मानता है और मेरे को रिडिक्यूल करता है, तो मुझे गुस्सा करता है. हाँ, तो आई गेट रिडिक्यूल्ड बाय थिंग. तो फैमिली थेरेपी में बताते हैं कि भाई आपका इंसाइट ये है कि इंसाइट बिल्डअप करना हमारा काम है कि भाई आपको ये नुकसान होगा, ये फिजिकल इलनेस होगा, ये इकोनॉमिकल प्रॉब्लम्स होंगे. तो दवाइयां तो है ही, लेकिन साथ साथ में उसका इंसाइट कि उसका फिजिकल, देखो देयर इज वन थिंग नोन एज इमोशनल इंसाइट एंड वन इज नोन एज इंटेलेक्चुअल इंसाइट. देखो सब लोग जानते हैं कि स्मोकिंग करना अच्छी बात नहीं है, बराबर है, लेकिन व्हाई डू पीपल कैन नॉट लीव स्मोकिंग? बिकॉज दे आर नॉट इमोशनली कनेक्टेड. कि भाई मैं इमोशनली कनेक्टेड नहीं हूँ. अगर मेरा कोई फ्रेंड मर जाए और मैं उसका पेन देखूं, तो आई विल गेट इमोशनली कनेक्टेड. तो इमोशनल कनेक्टेडनेस आएगी ना बाद में, तो उसका इमोशनल इंसाइट बढ़ेगा. एंड दैट इज द रीजन व्हाई वी हैव टू वर्क फॉर डी एडिक्शन. और डी एडिक्शन जो है, जो डिटॉक्सिफिकेशन बोलते हैं, जो इनिशियल पीरियड होता है तो डिटॉक्सिफिकेशन का होता है. एंड देयर आर फिजिकल विड्रॉल सिम्टम्स, देयर आर साइकोलॉजिकल विड्रॉल सिम्टम्स. तो फिजिकल विड्रॉल सिम्टम्स जो होता है जिसमें हाथ पैर कांपते हैं, and there are many other substance specific withdrawal symptoms which we can discuss later. तो उसके बाद वो symptoms कम होते हैं, बाद में we have to give them the medicines for anti craving medications, so they will not again go for the substance.
That's brilliant, sir. I really like that point that you brought up, that insight. You have to help them understand that insight. Why is it important to leave the substances, and how can it be actually hurtful for themselves or for their family?
Yes.
Thank you so much, Dr. Nirav Mehta. This brings me to the end of this show, and it has been very insightful, and we all have to come together, to help everyone come out of these problems, so that we can make this world a substance abuse free world.
Thank you for inviting me.
Thank you so much, Dr. Nirav. See you in the next episode of Wake Up to Health Talks.